We've got decades of research describing the problem of inequalities. The big problem is we don't have the solutions to know what to do about health inequalities. By inequalities, we mean unfair differences in health or health care.
So we're talking about people who maybe can't read, people who maybe are new to the UK, people who even are classed as living in poverty, and for whatever reasons they can't even afford calling their local GP. So how do these people access healthcare? Over the past 2 years, there's been 2 independent studies which have both looked at how to make general practice more equitable. Equalise was led by the University of Cambridge, Fair Steps led by the University of Sheffield. We came up with 5 themes which emerged as key underlying principles of this vision of a positive, fairer general practice.
The First Step study has come out with a series of recommendations and things that they have asked experts, and experts have agreed are good things to be implementing in general practice. And each one of those has got a series of interventions which have a matrix looking at how useful they are, but also how easy they are to implement. And one thing that we suggested as a PPI group was that it's very important for these services to have a link with local charities on the ground, so they know what the needs are for this part of the community, and also how effective that service will be.
People in the older generation, they don't even have smartphones. So how can they use the app on the phone? If they don't have a smartphone, they can't use it. If they can't speak the language, they'll have difficulty in reaching to their GP. And that's where the communities and the health officials need to work together to find a common way forward to address the needs of the different communities.
The community which I represent is the Muslim community, and most of them they've got the language barriers. They don't know how to fill in the form, and some of them they are not able to read the forms as well, or read any questions or anything.
I stand up for my community. I reach whoever I need to reach, and I speak about it, and I speak loud. So everybody would be heard. In the last 2 years, maybe, the trust from the community grown up, and they trust NHS more now than before because they can access things. They can access information they need.
Poverty and not having access to resource is such a key part of how patients access healthcare. The First Step study came up with this suggestion that actually general practice might think about having welfare advisors based in surgeries in order to try and support patients.
Our main point is to reduce the pressure on the healthcare system. I basically speak about what's the challenging in their life rather than just the healthcare. So I speak all about non-clinical things that are affecting them.
To make healthcare flexible, members of the community, no matter who you are, feels comfortable and is able to access healthcare.
I think First Steps will make a massive contribution to people who are from underserved communities to access healthcare.
A well-written, easily accessible framework for recognising which of your patient groups may be facing particular health inequalities and guiding you through the process for developing an intervention is really helpful.
I'd like to see these 5 principles, which are evidence-based and data-driven, being embedded into how we design general practice services.